Watch this.
Idaho is about to go into a place we've never been before. Kootenai Health, the largest hospital in northern Idaho, is on the tipping point of calling on the state to enact crisis standards of care. Within 36 hours this week, 4 of their COVID patients have died. 3 of them were under the age of 45. And as it stands right now, 96 COVID patients are in their hospital, beating their previous high of 91 back in December. And based on their models, they say they're expecting that number of 96 to continue to go up, and quickly. Yesterday, they installed a bigger oxygen tank because the patients they are currently seeing have a greater need for oxygen. There's the old one there being put on the truck, the new one on the ground. Today, hospital employees worked to convert the hospital's largest classroom into a patient care center. This is what that room looked like usually, filled with people there to learn about, well, healthcare. This picture is from 2019. That's pre-COVID. This is what that room looks like today, transformed into an overflow COVID unit. There's room for 22 patients in there with what they call low acuity COVID, meaning they don't really need that major attention at that moment. This isn't in a third world country, and this isn't after a major crisis here in Idaho. The hospital has also converted other rooms to provide extra space for other patients who do not need to be hospitalized, but they do need regular care. They also say 97% of those in the hospital with COVID are unvaccinated, something we've heard from Treasure Valley hospitals for weeks. They are saying the same thing, or they're seeing the same thing, and they're on the same path for potentially calling on crisis standards of care. It's something we came this close to happening. We saw this close to happening last year. Of course, that was a little bit different. We didn't have the vaccine then. Today we do. And it is the unvaccinated that are filling up our hospitals and intensive care units. Frankly, it's just a matter of space and not enough people to take care of patients in the hospital. And whether you want to hear it or not, yep, we got to tell you about this. State leaders are close to triggering this crisis standards of care. Joe Parrish shares insight on this situation in Idaho and in the region.
Medical systems across Idaho are seeing dwindling resources as ICUs and hospitals fill up with very sick patients battling the coronavirus. It's reminiscent of December 2020, the most critical and challenging time Idaho fought up until now.
Very concerning is that the number of patients in the ICU with COVID-19 is now the highest it's ever been across the state at any point during the pandemic.
Idaho Health and Welfare Director Dave Jepson toured an ICU in the Treasure Valley only a few days ago. Like the accounts from frontline healthcare workers we've heard, Jepson describes a morbid and tragic scene.
It's really hard to describe the amount of sadness and suffering that's occurring there. The ICU unit was full of COVID-19 patients that were all struggling, many for their lives, and it was very, very challenging for them and their families.
Crowded ICUs, hospitals, and medical centers are already seeing consequences of overpopulation. During the West Ada School District meeting Tuesday, Dr. Jim Souza, Chief Medical Officer at St. Luke's, described the reality of the current situation.
The bottom line is that the high quality of care that I think we're all used to has already eroded significantly. I would say that what we're providing today is substantially less than the standards we'd expect, but it is the best we can do. And we're headed in the wrong direction.
Dr. Souza added that the standards of care has now evolved from operating under community standards of care to contingency standards. That is one step ahead of crisis standards of care, the protocol enacted when the medical system is so strained that hospitals would need to ration care and treatment based on need, severity, and available resources.
We are dangerously close to crisis standards of care. In fact, last week we brought together the Crisis Standards of Care Activation Advisory Committee just to prepare them in case we actually were called upon to make that decision.
That action can be requested from hospital systems as they see the need. It's simply wait and see if that happens. Regionally, Idaho isn't alone when it comes to serious COVID situations. Utah, Nevada, and Oregon are all reporting increasingly difficult circumstances. That means if Idaho runs out of resources, patients may be hard-pressed to get treatment in neighboring areas. Our sister station in Oregon spoke with ICU staff at a Bend, Oregon hospital. They outlined what happens when beds are filled with dying COVID patients. Other people in need of care are affected.
What keeps me up at night are the patients who aren't getting their surgery for their colon cancer because we're full of COVID patients. And that's what I lie awake thinking about every night. I think about the patients that I am discharging from the emergency department who normally would be admitted to the hospital, but I've got no place to put them, so we say, well, just go home and hope you don't die.
In Idaho, although it did get close, the COVID situation did not escalate to crisis standards of care in December of 2020. The truth, though, is that there's no guarantee that the Idaho health system will avoid that this time. Health and Welfare Director Dave Jepson says there is a major difference between now and late 2020.
We have the answer, and the answer is the vaccine. And for those of you that have chosen to get vaccinated, I say thank you. And for those of you who have not yet been vaccinated, I urge you to consider getting the vaccine.
All right, Joe, as you mentioned, we were this close before back in December. They did everything they could to avoid that, and we did avoid that. And we're kind of in that same situation now, but going back to that meeting yesterday, in an effort to avoid this, they're pulling out some drastic measures, aren't they?
Yeah, there's some serious need for staffing inside the hospital system and the medical system, to the point where they are now calling on the community for volunteers to fill a number of different roles. Some of these roles, Brian, they do require some type of certification or training. Others, they'll take anybody. Here's a website you can go to right now, www.volunteeridaho.com. We'll have this on our website in the story with more details. Basically, you fill out some paperwork, you look to see what's needed, and they hope to put you into a community volunteer role as soon as possible. Brian, this isn't a situation where we're asking people, oh, if you can come help, that'd be great. No, this is a need at this point. The problem is not just the amount of space in the hospitals, but it's also the amount of resources in terms of people, the nurses, the respiratory therapists, the emergency room doctors. There's only a finite amount of these people that are trained in our community to do certain tasks, to the point where they need help from other people here in our region. So if you have a special skill set, we also have reported throughout the pandemic that retired doctors and nurses were giving maybe considerations from medical boards to come back into the force, and they wouldn't have to go through the full process like they would pre-COVID. It is a serious situation. Again, more info at ktvb.com.
And this is like real up in Kootenai County right now.
Oh, yeah.
Thank you very much, Joe.
I would suggest that many times in this life, we can't have it all. So if the most important goal, even over everything else, is to keep kids in school uninterrupted for in-person instruction, our recommendation would be pretty clear, and I'm going to do this thing again at this time. Start school with a mask requirement for all staff and students. We believe that gives you the greatest odds of achieving that goal. If making everyone happy, or if individual freedom trumps that goal, then the cards will fall in a different way, we think.
I guess we're about to see where those cards
anything?
might fall. That suggestion from Doctors James Souza and Kenny Bramwell, both of St. Luke's, came about an hour and a half into a five and a half hour meeting last night with the West Ada School District Board of Trustees. And that suggestion to make masks required for all staff and students to start the school year was just one of the options floated by the board. There were two others. Option one, let the superintendent decide, which is where they stood going into last night's meeting. And back in June, the superintendent decided to let masks be optional. Then there was option two, masks required for everyone or by grade level. Then there was option three, masks required for everyone, but parents can opt their students out if they so choose. So a mandate, but one that really doesn't apply to everyone. Let's go back to what Dr. Souza said while making his recommendation last night. Many times in life, we can't have it all. Well, West Ada School District is certainly trying to do that, because nearly 5 hours later, which included 90 minutes of public testimony, they went with option three.
All those in favor, please say aye.
Aye.
Aye. Chair votes aye. All those opposed, please say nay. Motion passes 3-2.
And there's the cheering. And here's what that means. Masks will be required in all grades across the school district, including teachers and staff. But parents, as we said, can excuse their kids from that requirement by turning in an opt-out form. A form that was sent out to parents this morning just before 10 a.m. And the district began accepting those opt-out forms at noon. In a matter of hours, guess how long the line was at the district office? Here's Katya Stepovic with the answer.
Hundreds of like-minded parents waited in line to submit paperwork and identification to ensure that when school starts tomorrow in the West Ada School District, their children will not be masked.
I just don't believe that basically the masks really work. And I think that they should have a choice to wear it or not.
Curtis Shaw, a father of 2 kids at Meridian Middle School, says he's lucky he had the day off because he didn't really know that this is what he was in for.
So I'm coming down here and now it looks like I'm gonna have to sit here for an hour or 2, you know, when this could have just been done online or something. I have to show my ID to prove that my kids, I mean, it's just.
But at the end of it all, for these parents, it was a line worth waiting in.
I don't want my kids wearing masks all day.
Why?
I don't think it's healthy for them.
In what ways?
Well, I think they need to be able to breathe freely and not be restricted.
Kids will get sick. That's what they do.
Some of the parents spoke last night during the district's board meeting, and the West Ada board listened, giving parents a choice to mask up their children in the school setting or not. So the turnout today, not shocking to school officials.
I don't think we knew what to expect. I mean, I know that we know that parents do want choice when it comes to their child, and especially when it comes to their health. So, you know, we kind of had an expectation that it would be a high number.
After today, hundreds of students will be in the system with a note that tells teachers and staff that their parents have opted them out of the mask requirement. The district will accept papers until Friday. At that point, parents can turn in opt-out forms to their schools directly. And if they don't get it turned in before school starts tomorrow,
so our principals are going to work with families and students, you know, offer some grace over the course of the next couple of days, knowing that those forms are going to be trickling in. I think we've heard that from parents that parent choice is extremely important, and so hopefully by offering that opt-out and that choice, you know, it will kind of ease whatever parents have about starting school. Will kind of make that a little bit easier for them.
So if you'd like to help us maintain it and make sure they don't try to take it away.
the district says the goal is not to make all parents happy, but to keep students in-person learning 5 days a week. And today, some walked away with the confidence that that goal will be achieved.
I think that this speaks volumes of what people really feel, and I think that the school district so far has not listened to what the parents wanted. I think that the turnout here today just kind of shows the voices that needed to be heard, that weren't being heard.
All right, Katya, there are 40,000 students or so in the West Ada School District, which is why we call it the state's largest. It is pretty big, which means there are at least 40,000 parents that have this option. This could be an administrative nightmare with all these forms coming in and school starting tomorrow. How are they going to handle all of this, and what happens to enforcement?
Well, unfortunately, it could be just that, because just like some teachers had to deal with medical or religious mask exemptions last year, they will likely be the enforcers this year too. But obviously, there will be a lot more exemptions, so to speak. And this is all still very, very new. So Char says in the coming days, the logistics will become more clear. But she says teachers will know what students are on the opt-out list, and if needed, administration will come in to help.
All right, we'll see. Again, this is going to be very kind of fluid over the next couple of days at least, and maybe for the next several weeks. All right, thank you very much, Katya. What about schools that have a mask mandate, a mask requirement? What's it been like for those school districts who've already started classes? For example, Boise School District. All the schools in the Boise School District require masks indoors. Then there's Caldwell. Caldwell School District started the school year last Wednesday with a mask recommendation. Monday for Boise, it was a mandate. Yesterday, 3 schools in the Caldwell School District announced they are now implementing masks after starting the school year without that, because more than 10% of the student body at Caldwell High School, as well as at Washington and Lincoln Elementary Schools, have been absent. That's about 2,200 kids in those 3 schools. So if their limit is 10%, which is where they were going to start this mask mandate, you'd think that'd be about 220 kids that are not at school. The district says at least 78 of those kids are in quarantine. Meanwhile, over in Boise, they started the school year with that mask mandate, and they've been in for about a week and a half. And they've had 48 cases of COVID across 23 of the district's 51 schools. 30 schools have recorded no cases at all as of today. You can see a breakout exactly where those cases are on the district's website, which will be included in this story at ktvb.com. So more kids out in Caldwell in a shorter amount of time. By the way, those 3 Caldwell schools will be required to wear masks until at least September 3rd, which is next Friday. And at that point, the district is going to reevaluate the case counts. And if those absences drop below that 10% marker, that requirement will go back to just recommendations. The Boise School District is going to continue requiring masks for everyone indefinitely. Last night's school board meeting also provided another side to the mask debate. Those in favor of wearing them and those very vocally opposed. A separation on full display last night that could carry into the classroom. All right, let's put this COVID aside for just a second. Pick up your phone and text us, 208-321-5614. We want to hear any questions you have about today's show and any comments you want to share with us as well. All we ask is that you include your name and the hashtag #the208. But stick around, we might share yours at the end of the show. We wanted to take a moment to go back to the West Ada School District Board meeting. Because as you can imagine, by going with this mask mandatory for some, but not for all, whose parents don't believe in it, they've successfully set up 2 classes of students. Sure, those of us from older generations, we'd like to think we've evolved from when we were kids in school, when pointing out and making jokes about those who were different, well, was commonplace. And sadly, not only accepted, but sometimes expected. Maybe you didn't have the cool backpack, couldn't afford the trendy shoes, your hand-me-down pants were a little long or a little short. We saw it happen during the last school year. Kids being bullied over masks. It's bound to happen.
You know, it's just something that may unfortunately happen, and we're just going to have to see what the best way is to, try to ensure that doesn't happen, because we definitely want choice for both sides. We want a student to be able to wear a mask and, not be fearful of that, and vice versa.
And sure, that's not on the district, but you know what else may unfortunately happen? Kids learning how to behave from their parents. And to think bullying doesn't pass from generation to generation would be foolish, evident by what we saw in last night's school board meeting.
Do the right thing. Stand on the right side of history. Mandate masks at every grade level. Thank you.
Thank you. And please, I really would like to just keep this going, and I appreciate keeping the respect at the level we need it to. I know this is emotional.
Yeah, it was mentioned more than once during last night's school board meeting, members of the audience not really being respectful of the person that was speaking at the podium, hand gestures and whatever, and it wasn't just adults. Kids were doing the same thing. Granted, what we saw last night pales in comparison to what we see in memes and on comments posted on any social media page that encourages masks or vaccines, or vice versa. But what was seen was enough for school board trustee Renee Ozuna to call it out, that if we're going to go with this some masked and some not, we can't go with what we saw last night.
We need to make sure that our kids are being kind to each other. Tonight in the testimony, I watched some eye rolling, I heard some comments from adults in this room when somebody was speaking that had a differing opinion of you. We've got to do better than that. We expect our kids to do better than that. We need to do better.
Simple enough message for parents. To paraphrase a public service announcement from my generation, they learn by watching you. And if you expect your kids to do better, well, then you have to do better. And for our kids' sake, let's hope it'll be a lot better than what we've seen the past year and a half. Raise your hand if you didn't expect us to be talking about mosquito control 4 times in the past 6 days. Usually, a story like this would be like a 30-second story, letting you know the abatement district is going to be spraying to kill mosquitoes that are likely carrying West Nile virus. Just to give you a heads up. But thanks to social media and misinformation, the story continues to linger a lot longer than the actual insecticide used to kill those mosquitoes. Well, after being postponed twice, and a morning meeting between Ada County commissioners and the mayors of the cities that will be sprayed, that spraying is back on, beginning tonight at 8:30. Ada County is going to be dropping an aerial application of bug spray in parts of Meridian, Eagle, Star, and Cuna. We're told the insecticide is used is very small, in very small amounts, and it kills mosquitoes on contact. And it's also supposed to dissipate quickly from any surface it lands on. It's formulated to not hurt any other animals or vegetation or even bees, since they will be in their hives by the time they start spraying. And they should be up flying till about midnight tonight. And the goal is to kill the surging population of mosquitoes carrying West Nile virus in Ada County. You can see here on your screen exactly where that will be happening. All right, final minute of the show. Let's get to your comments you sent in during today's show, like this one from Roy. With the current hospital crisis, maybe it's not good timing to fire 20% of their staff since they are unvaccinated. Well, actually, as we learned yesterday from Dr. Souza, 250 people out sick in the St. Luke's health system, 150 of those with COVID, which is why they're kind of requiring that so they can avoid that situation. As a teacher in West Ada, I now need to spend precious instructional time looking up who can and cannot be without a mask and monitor the bullying that will most certainly happen. When is there time to teach? How is this good for kids and teachers, asks Michelle. History teaches us that by bowing to an angry and shouting minority, it never ends well. Why are we letting this happen, asks Colin. I was called mask Nazi and disgusting and heard a man sitting near me say he would kick me in the face during the board meeting last night, all for exercising my rights to wear a mask and speak up in a public meeting. I don't have very high hopes that those people who won't teach their kids to do the same. You guys need to quit asking people's opinions. This is what gets people angry at each other. I feel like that's what you're trying to accomplish. This is on us?